The Institute of Race Relations partner saying government's proposed national health insurance system will drive the private sector out of healthcare. The group argues that while South Africa's public health services is in desperate need of reform, NHI is not the answer. Marius Roth is joining us now from the Institute to explain the outcomes of their recent research. Marius, good morning and thank you very much for coming in.
Good morning.
Yeah, I've seen the press release that you have issued. I have it in my hand here from the Institute of IRR about this research that's been done by the head of policy research, Dr. Anthea Jeffrey at the IRR. Just at a high level, what has she found?
Well, she found that NHI is probably not the answer to the problems in the South African healthcare system. Firstly, NHI will result in more government control in the healthcare system, and there's already quite a lot of failures within government-controlled healthcare. And we're also not sure, the government itself is not sure how we will pay for NHI. The government, Dr. Evan Motsoaledi, the Minister of Health himself, has said he's not actually sure where we're going to get the money from, and National Treasury will have to find it. So we're not sure, will it come from extra taxes or additional payroll taxes? And although the initial estimates put the cost of NHI at about 250 billion rand, we think it'll be closer to about 1 trillion rand. And the Davis Tax Committee also said,
why would it cost that much, up to 1 trillion, in terms of the research that you've seen? That you say there's an estimate of 250 billion, you say it could go up to 1 trillion. Why would it do so?
Well, to pay for everybody's healthcare, it's going to be expensive. And if we get, according to the new NHI proposals, people will be allowed to belong to medical aid schemes, but they'll first have to pay into NHI. So this money will have to come from somewhere, and it's most probably going to have to come from the taxpayer. And the Davis Tax Committee itself has said, without high economic growth, NHI is probably unsustainable.
And what about things like medical aid schemes, the NHI? From your research, are you finding the impact there would also be negative?
Yes, as I say, at the moment, the NHI does allow, will allow medical aid schemes, but people will first have to pay into the NHI. So probably for a lot of people, they would rather, they might not be able to afford medical aid as well. So we'll probably see a decline in the number of medical aid schemes.
What about the overriding argument? I mean, I don't know if it's come out in the research by Dr. Anthea Jeffrey and what people have commented on that in that research, that it's maybe healthcare needs to be, the playing field needs to be leveled. You have a world-class private healthcare sector, so to speak, that is supporting millions of South Africans who, through medical aid schemes, who are paying every month. And I know for a fact that many of our African brothers and sisters also come in here, those who can afford to, and they can access it as well and use it. But we have a public sector that's really in a crisis, that's battling, but somehow you need to find a way to level the playing field, and that NHI might be that answer.
Well, as you say, the private medical care is world class, but we don't think we need to bring private medical care down to let other people in. We've seen how the government healthcare system is struggling, and we don't think this is because of a lack of resources. We already spend a lot of money, especially for a country of our income, on medical resources and public healthcare. What we think the issue is things such as management, no consequences for when there are issues in hospitals. We don't think additional resources will help this. We need better management, better consequences, or more consequences for when people do mess up in hospitals.
In the research, doesn't it show that perhaps NHI might be the answer to improving management?
There's no evidence that this will happen. I mean, NHI will lead to more government control of healthcare, and we've seen what does happen at the moment when there is when the government does get involved in running entities. We've seen, I mean, we can just look at most of our SOEs in the country. When the government does run them, things, management control is normally, management is normally quite poor in these entities. There's no reason to think that NHI will be any different.
Yeah. So in this research, I mean, what kind of possible way forward have been brought out?
Well, we think there's a number of things we can do. We can be additional public-private partnerships we think can be brought in. We think perhaps people can be given health vouchers to decide on where they want to go get their health care from. We also think we should allow medical aid schemes for people on lower incomes, which the government has actually blocked. And perhaps everybody who's employed needs to be on a medical aid scheme. People on lower incomes could then be subsidized by...
And companies would have to fund that.
Yes, but then they could get... We suggest that these companies could then get tax credits, so to cover the subsidies that they would be paying for their employers on lower incomes, for example. So we do think there are a number of ways of getting more people into the private sector to take the pressure off the public sector, but at the same time we do need to improve the public sector.
Yeah, now this report that you've come up with is going to be made available to the government?
It's available already on our website, but this is all part of our submission that we'll be giving to Parliament before the 21st of September. And if anybody has comments on the NHI, they can make their own submission, or they can go onto our website and endorse the submission that we will be giving to Parliament before the 21st of September.
Okay, Marius Rood, thank you very much. Marius Rood from the Institute of Race Relations, they're giving us highlights of the research they've done into the NHI, and that will form part of the submission next month into Parliament of the process of whether or not South Africa can afford national health insurance.